Today, I will be guiding you through Chapter 3, Reading and Critically Appraising Research. In this module, covering 3 chapters, of which this is only one, we have 5 learning outcomes. By the end of the module, I hope you will be able to identify the major sections of a research article, differentiate between primary and secondary sources, conduct an effective search of the literature, critically appraise criteria of research studies, and critique the ethical aspects of a research study. There are 2 major places clinicians and researchers get their information about ongoing research. Journal articles, which generally report the findings of research studies and papers that are less than 20 double-spaced pages. This means the content is dense for novice readers and technically difficult. Conferences give researchers the opportunity for oral or poster presentations of their material. Generally, a presenter has 10 to 15 minutes. The most significant difference is the audience is given an opportunity to ask questions and discuss the research with the presenter. There are obviously other places, such as government organizations and professional organizations, that are trusted sources. However, social media is not a trusted source. While there are many people that will link you to trusted sources, it is up to you to make sure you know the difference. All too often, there is false information that is shared by either bad actors or people who do not know what they are sharing is false. Most journal articles follow a similar format. There is a title and abstract, the introduction, methods, results, discussion, and finally the conclusion. Let's review each of these sections. After searching for articles, the first thing the person will see is the title and the abstract. Both are very important if you want people to keep reading. I've copied 2 abstracts of articles I published from one of my research studies. They were published in different journals, and as a result, the format was different. The abstract on the left is the abstract on the right is a more normal format for a research article. The abstract should be brief, almost always less than 200 words. And the abstract generally answers the questions: what were the research questions? What methods were used to address those questions? What were the findings? What are the implications to nursing practice? Let's see if you can answer the question in the abstract on the right, since it is easier to follow. What were the research questions? The study assessed current health care student disaster competency and curricula resultant confidence. What are the methods used? You can see there is a method section that answers that question. What are the findings? The findings are in the results portion. And finally, what are the implications? This is generally found in the conclusion. The introduction is also sometimes referred to as background. This section contains central phenomena, concepts, and variables that are being studied, the study purpose and research questions or hypothesis, a brief overview of related literature, theoretical and conceptual framework, and the significance and need for the study. In this case, we wrote, emergency care requires specialized skills, and emergency departments need a unique and expert workforce. As a result, the emergency care workforce consisted of approximately 60,000 emergency medicine clinicians, of whom fewer than 2 out of 3 were emergency physicians. Since then, there has been tremendous growth in the use of nurse practitioners, with an estimated 47,700 practicing emergency physicians working in 2019. If you go on and read the next few paragraphs of this paper, it gives you more detail. The primary objective of this review was to seek evidence to support nurse practitioner education and training to determine if it aligns with current practices in an emergency department. So when you get to the end of the introduction or the background section, in the very last paragraph, we tell how we did this. We say we searched the cumulative index of nursing and allied health through Abisco, Scopus, and Web of Science. 3 topic areas within these concepts were identified and searched, and then we won't go on to give more detail about how that was done. So, thus we showed that we had a central phenomena, concepts, variables that were being studied. We stated the study purpose and the questions or the hypothesis. We gave a brief review of literature in the introduction section. We discussed the theoretical and conceptual framework, and then we had discussed the significance and the need for the study. The methods section for qualitative and quantitative research will be slightly different, but we will discuss that in more detail in future chapters. For now, let's focus on the basics. The methods section should include the research design, a sampling plan, the methods of measuring variables and collecting study data, study procedures including protection of human subjects, and data analysis methods. The results section tells the reader what you found. The findings are usually reported in both narrative form and in tables of statistics. Among the things you will have is a presentation of key findings, narrative summary of the findings. They should include the statistics used, values of calculated statistics, and the statistical significance reported as a p-value, and it's usually going to be a p of less than or equal to 0.05 or less than or equal to 0.01. You should have tables of findings, and then you'll usually have some descriptive information. The author will tell you the statistical tests that were used. This allows the researcher to test the hypothesis. The statistical test helps answer the question if the relationship is real. In one of my studies, I showed you earlier, we found both administrators and students express low confidence in competence, with students significantly lower with a p of 0.001. Nurse practitioner students scored higher, and the p was also less than or equal to 0.001. Thus, we concluded that healthcare students report low coverage of topics considered to be necessary disaster response competencies, as well as their confidence to execute functions. This may negatively impact willingness and ability of those professionals to respond effectively in a disaster. What researchers want to know is if the results are statistically significant, which is to say, the findings are probably true. With a p of less than or equal to 0.05, it means that only 5 times out of 100 are the findings false. The smaller the p-value, the more reliable the results. I would rather have a p of 0.001 than a p of 0.05. As we will discuss later, qualitative research does not have statistics. But let me focus just a little more on the p-value than your book does, because it's important to help you understand the articles. We already said that the p-value helps you to know if the test results were significant or true. If you look at the figure on the slide, you will see a line that says 95% statistical significance threshold and another arrow pointing to observed p-value. Anytime I do research, I'm trying to show a relationship between the two variables, let's say nursing education and confidence in responding to a disaster. The p-value helps me determine if my study of nursing education and confidence is significant in relation to my hypothesis. Do you remember what the null hypothesis is? It essentially states that there is no relationship between the variables I'm studying, or nursing education does not affect confidence to respond to a disaster. In other words, what I wanted to prove didn't happen. The education did nothing to confidence to respond. The p-value tells me that likely my results were random rather than what I wanted them to be. Education impacted confidence. A p of less than 0.05 indicates that my findings were statistically significant or evidence against the null hypothesis. One more time, the null hypothesis would be that my results were random. I don't want that. Now, when the p-value is less than 0.05, I reject the null and I'm happy nurse researcher because I can at least reject the null or say that my results are not random. It doesn't necessarily mean they are true. What it does is provide some support for my null hypothesis. If you are still confused, you can join me for office hours and I will try to explain further. The discussion is where the researcher tells the story of the findings. It's important for this part to be understandable to the reader. You may present interpretation of your results, clinical and research implications, and study limitations and ramifications for the believability of this study. Often, clinicians will go straight to this section of the paper. The better job you do in this setting of the article, the easier it will be to read. It is also important to remember that some of the things that make an article hard to read are the density of the information, the jargon we all tend to use, the efforts to be objective, which means it isn't always straightforward in the way it's written, and the amount of statistical information that nurses don't read often and so isn't something we practice. Here are some tips for reading research articles, and they may also help reading your textbook. The more you read research, the easier it gets. Don't try to speed read. Take your time. Read the article a second time to make sure you understand it. Your textbook is a good reference. It's a good practice to stop and look up what you don't know or can't fully remember. Don't let the stats bog you down. The more you read research, the more natural it will become. One of the things you will be doing every week in this course is critically appraising research. So this section is important to you. I'm putting the table in so you will know to which one I'm referring. But I think you should also open your book to table 3.1 while you listen to this section. It will help you be familiar with it, and I can't stress enough how important I think this is. The table is divided into aspect of the report, critical appraisal question, and then gives you the page number for the detailed appraisal guidelines. This should be used every week when you are appraising your articles. Please review the specific questions in the critical appraisal column and have those with you when reading your article. You may also want to look at additional guidelines that are on the website for your book. No guidelines will perfectly fit every article, but they do give a novice reviewer a guide. Now let's take a little bit deeper look at this table. You will notice that it goes through research design, the population of your sample, the data collection and measurement, procedures, and then in results it talks about data analysis and the findings of interpretation, and then a summary of assessment. Now you can obviously read through these questions in your textbook, but here's why I think it's important. When you're doing the critical appraisal of your research, one of the things I want you to do is look at the research design, and you might ask yourself, what was the level of evidence for the study, and was the level the highest possible for the study purpose? What were the number of data collection points? Were they appropriate? What period of follow-up, and was it adequate? And did the design minimize biases and threats to validity? As you go through this, what you will see is that in future chapters, there's more detail about each of these elements. So, to determine if the evidence supports the inference made by the author, you need to do these critical appraisals in the process of this course. Next, let's think about reliability. And so, here is another table, 3.2, and you will notice that this is for qualitative studies. What you will find here is that it is slightly different, but it's set up in the same format. It gives you the same level of information, and it should be kept with you as a guide. Again, you will learn more about this as we go through the semester. As a nurse researcher, I want my work to reflect the truth. I studied disaster nursing, so the last thing I want is to be biased in my work and have results that are wrong, or making bad recommendations that, rather than improving outcomes, could have no impact or make things worse. I want my studies to have scientific merit. To increase the likelihood the studies do have scientific merit, I want to increase reliability and validity and reduce bias. If I'm doing qualitative research, I would likely refer to trustworthiness, which may include credibility, transferability, confirmability, dependability, and authenticity. Let's talk a little more about reliability, validity, and credibility and what they mean. Reliability refers to accuracy and consistency of your measures. If you take a temperature and it's 98.1 and then you immediately take it again and it's 102, it is not reliable. Validity refers to the concept or measure being consistent with the real world. If I'm measuring depression, it needs to accurately measure depression and not loneliness. Another aspect of this in a study is, did the independent variable really affect the dependent variable? Was the nursing intervention responsible for the outcome, or was it something else? Finally, credibility is important in qualitative methods. It is important for the work to be credible, and for this, the methods must inspire confidence that the results are truthful and accurate. Bias is defined in your textbook as a distortion of influence that results in an error of inference. Another definition is any tendency which prevents unprejudiced consideration of a question. Any tendency which prevents unprejudiced consideration of a question. Bias can occur at any point in the study, from the planning to the implementation to the analysis. I've attached a table from Panucci and Wilkins about ways to avoid bias. This may be helpful to you when reviewing articles. For example, flawed study design. Clearly define the risk and outcomes, and preferably with objective or validated methods. To standardize and blind data collection. And for selection bias, the selected patients using rigorous criteria to avoid confounding results. Patients should originate from the same general population. And if you go through this table, it gives you criteria along the research process, and it helps you thus to reduce bias. I would encourage you to review the rest of this table, or better yet, to read the article. It's easy to read, and I think you will find it helpful. We close this chapter by discussing what is very important when doing research. A researcher wants the study to be applicable to outside populations. I don't want my research to only apply to the small number of people in my study. I want it to apply to a more general population. This means quantitative researchers want their study to be generalizable, and qualitative researchers want their researchers to be transferable. Generalizability is the extent to which the findings can be applied to other groups or settings. And transferability is the extent to which qualitative findings can be transferred to other settings. I hope this brings you a little bit of understanding and guides you through the important aspects of the chapter.